About 200 drugs are being considered as possible treatments for COVID-19. One standout is an experimental drug developed and used to treat HIV called leronlimab. Joining me now is Dr. Nader Pourhassan, the CEO of Cytokine, the company that makes leronlimab. Welcome, Dr. Pourhassan.
Thank you for having me. Appreciate it.
Your drug, leronlimab, was approved by the FDA to be given to COVID-19 patients on an emergency basis, on a compassionate use basis, and it was given to 5 patients who tested positive for coronavirus. How did those patients who were given your drug, how did they do?
Well, it wasn't just 5 patients. It was emergency IND, which is different than compassionate use, and it was given to over 40 patients by now. And the patients, the first 11 were from Montefiore Medical Center, which is Albert Einstein College of Medicine, the hospital for it. And those 11 patients, the first 2 especially, because that was the very beginning of somebody believing in leronlimab and our scientists. And one of them self-extubated. That means he became alert and took the tube out of his own mouth and got out of ventilation. It was a very pleasant surprise for the doctor. Immediately, he asked for 2 more. Then they got 4 patients. Total 11 patients on Montefiore Medical Center. Then South California, it was on CBS News when the first patient for Dr. Yang, who has gone on public and talking about it, she was in the brink of not being able to make it. Many drugs did not work on her. And then they gave her leronlimab. And she talked about it, how she was given a new life. And it was her birthday, April 5th, 2020, and she became 55 years old, and she was able to survive. She's willing to talk to the media. There is other patients right now. So from those 40 patients, many of them extubated, many of them have talked about it, and there are testimony out there, and we are just hopeful that we can get through our trials. FDA has immediately given us two trials, one randomized phase 2 trial for mild and moderate, and one phase 3 for severe population. And we're enrolling as fast as we can and hoping to have results from our first 75 patient trial very quickly.
We know many patients who die from COVID-19 succumb to what's being called the cytokine storm, where our immune system overreacts. Normally, we think it's a good thing when the immune system works really hard, but it can work too hard, leading even to death. Can you explain how your drug calms and suppresses that so-called cytokine storm?
So papers have been published in the past. Dr. Bruce Patterson, who's our scientist, he's a former Stanford University professor, head of virology department at Stanford, expert at CCR5. So what is CCR5? It's like an antenna on the T cell. And all these immune response that you see, macrophages, T regulatory, and T cell helpers, they all have CCR5. When our product, leronlimab, which is a humanized monoclonal antibody, so once a week self-injectable at home, when it binds to CCR5, it calms down and regulates the immune system. This is very, very important. Our scientist, Dr. Jacob Lalezari, who's involved in this very deeply, is our chief science officer, Dr. Scott Kelly, chief medical officer, Dr. Bruce Patterson, the scientist who's leading this, Dr. Jonas Sasha. They can't sleep at night time. We all get on the call every night and we say, how do we expedite this process? FDA has been great with us. We have 75 patients, but people are dying right now. They're asking us for drug, and when we send it to them a couple of occasions, they got the drug and they were dead already. And we're saying we need to have a compassionate use established immediately, so we have asked FDA for that. So they probably will give us that. I'm not sure. We will see. We want to be 100% aligned with FDA, but it's really, really hard to sleep at night when you know what you have. And we're publishing, by the way, those data from 2 different sources. Dr. Bruce Patterson and Montefiore is publishing. The publication will show that the cytokine storm, and there's a lot of other things in there that I can't talk about it because of the confidentiality of what's coming out, is going to be the reason why patients die. And if we can stop the death, this is just a flu. It won't do anything. The whole country can be reopened and everybody's going to be safe if this works the way we think. So I'm putting a big if over here because I don't want people to think I'm trying to say it's working for everybody. So far, results have been tremendously positive. Are we going to have that results? Well, Dr. Yang said he enrolled 14 patients. The first 6 patients in severe cases, he said 4 of them got discharged. They got out of oxygen that they need within 24 hours, 2 of them within 24 hours, the other 2 within 3 days. So I'm just, it's very, very difficult not to have it available for everybody. But again, we must go through exactly what the FDA says, and we're following those criteria.
Indeed. All right, Dr. Nader Pourhassan, the CEO of Cytokine, the company that makes leronlimab. We wish you the very best. Thanks for being here.
Thank you for having me.